Healthcare in America is growing at an unsustainable rate, and probably most importantly, it's rising at a rate that's higher than the pay increases that their employees can have.
Hi, I'm Steve Lacey. I'm the chairman and CEO of the Meredith Corporation. I think it's really incumbent on all of us to look at non-traditional procedures, safe for your employees like Regenexx. We did that at Meredith. Not only have we had good success in terms of recovery, but a tremendous amount of financial success for our fully self-insured medical plan.
Before, the standard of care would be a patient would have an injury, go see their family physician. Usually leave their family physician, prescribe either physical therapy and some sort of NSAID. Now with Regenexx, people with partial tears can go get an SEP injection or a stem cell injection. We're able to get the patient functional faster.
In 2014, I brought the idea of adding the Regenexx procedures to Steve Lacey and Meredith Corporation based on my personal outcomes with a couple key goals. Number one is to reduce their orthopedic spend by over 50%, add a procedure that their employees would like, and add a procedure that allowed their employees to avoid invasive orthopedic surgery.
Compared to the cost of what would be a traditional possible hip or knee replacement, we've saved as a company out of our self-insured plan nearly $700,000.
An example of this procedure is the Regenexx patented procedures that can intervene on roughly 70% of all orthopedic surgeries in America.
So certainly when it comes to rising healthcare costs, that's a challenge that every company faces. And so certainly we want to be innovative with our strategy, but also can really help us make an impact on that trajectory. We feel like Regenexx has helped us do that.
We are able to say that we are saving Meredith over 80% of what their orthopedic surgical spend would have been. Their employees are choosing this procedure over invasive surgery 100% of the time, and their employees are experiencing an 80% improvement at 6 months.
Our employees like choice, and they especially like choice that is low cost and quick recovery.
My name is Jenny McCoy, and I'm the Director of Corporate Communications for Meredith Corporation. I have been a runner for most of my life, and as a result I had significant ligament generation in my knees and my hips. I had bursitis in my hip. I had nearly a torn meniscus. I had gotten to the point where I could barely walk a mile without stopping, and it was really very frustrating. So I went to Regenexx Des Moines for a consultation, and Dr. Jackson told me that he could inject platelets, and so I had that done.
Beforehand, it would say, okay, you have a partial tear, we're going to leave the tear alone. Adding this in to regenerate tissue as an option is nothing but a benefit to, one, the patient, and two, to the employer to keep patients and their employees functional.
I'm to the point now where I'm running again and couldn't be happier with the results.
People have gotten back on their feet much quicker and been able to return to the workforce at a fraction of the cost of a hip or a knee or any other body part replacement.
One of the key strategies for a multi-state employer is to be able to partner with a national network that truly has the depth and breadth to be able to serve their employees. Our growth pattern is actually accelerating, so we fully anticipate to have well over 100 clinics in the near future, and that should continue to grow each year thereafter.
From a physical therapy standpoint, we're able to get people active faster because there's not that trauma of having a surgery.
So from a bigger picture perspective, we endeavored into this with Meredith to begin with. The 80% improvement at 6 months, an 80% reduction in their orthopedic spend. By adding these procedures to your health plan, it affords the same innovative orthopedic alternative for all of your employees.